Hello everyone, this is Paul from Ortho Eval, pal, and in this video I want to talk about how to start some self-treatment for pain on the outside of your elbow or when you have tennis elbow. Okay, now I don't recommend a very elaborate exercise program or strengthening regime here for this. If you have this and it just got started, it's okay to start trying to treat this yourself to see if it settles down, because oftentimes it will get better on its own. But you need to remember why you developed tennis elbow in the first place, and it's usually because you're doing something repetitive with a lot of gripping and grasping, pushing, pulling, twisting, and doing that type of thing. So it's important that you try to avoid some of those aggravating factors that cause irritation. So if you are pushing a lawnmower that has a very small bar and causes a lot of vibration and you're squeezing a lot, that could irritate it. So put a little piece of pipe insulation over that to make that a little bit bigger so that it absorbs shock and you're not squeezing such a small object. The other thing you can do is just some gentle massage around the muscle that attaches to where this bone is and where you have this irritation. So doing a nice gentle massage in that area can help to settle that down. Now, if you're having a lot of discomfort right in that spot, you can ice massage this with pure ice, or you can put an ice pack on that area and get that cooled off to help control your pain. All right, so that can be very helpful. Now, it's important to try to improve the flexibility of this muscle group, because oftentimes you'll have a lot of spasm in it and it'll get really tight. So taking your arm and straightening it out like this, and with the other hand pushing your wrist down and out very gently to get a nice little stretch up and through here, can also be helpful. I generally hold that stretch for about 15 to 20 seconds, and then I relax, let it settle down some, and then I'll do that 3 or 4 times, maybe a couple of times a day, especially if I'm continuing to do activities where I'm doing a lot of gripping and grasping. Now, there are a couple devices you can use, and one is a tennis elbow strap that you put around this area over the muscle, not over where the sore spot is, and I will link a video in the description of this video today, so that you can click on that and go to it so that you can find out how we like to use a tennis elbow strap the best. There are many of them out there. There are some that work better than others. So if you're going to be continuing to grip and grasp during the day, it's important that you use that brace to help dissipate some of that force. Now at night, you can also help your tennis elbow by wearing a splint, like what we call a wrist cock-up splint. They're quite common. People with carpal tunnel wear these a lot. And basically, it holds the wrist up like this, and you can sleep with that brace on all night so that you're not in this position, causing a constant stretch and a bend and tension on that muscle all night long. So those are some simple ways to get started. Now, treating tennis elbow is daunting. There is no one treatment that will make it better, but oftentimes it is a problem of having weakness and inflexibility. Not only weakness around the forearm, but weakness around the shoulders and the shoulder blades. So the more stable we are up here, the less your arm has to work down here. So those exercise programs and treatment programs usually need some customization from a physical therapist or occupational therapist. So if you can't get this better on your own, you may need some guidance, and at that point I would talk to your medical provider about getting a referral to your physical or occupational therapist and see if you can get some treatment for it. So I hope those tidbits of information can be helpful in the early stages of having tennis elbow. And if you liked our video, give us a thumbs up and be sure to subscribe to our channel. Thanks.